group project, we chose to do the urinary system, and our pathology is renal calculi. The urinary system is a body system that has organs to produce, collect, and eliminate urine from the body. 4 functions of the urinary system: regulate chemical composition of the blood, eliminate waste products, regulate fluid and electrolyte balance and volume, and also maintain acid-base balance of the body. Some anatomy of the urinary system: it consists of 2 kidneys, 2 ureters, a urinary bladder, and a urethra. That's shown in our model later on.
So whenever you think of the urinary system, you think of pee. So we're kind of wondering what pee or urine is made. The blood flows to the kidney through the renal artery. The renal artery will send the blood into the nephrons, which contain the glomerulus. The glomerulus produces the filtrates that enter the proximal convoluted tubule. This is where the body decides to reabsorb or secrete the composition or the fluid and electrolytes back into the blood. From here, the filtrates will drain into the loop of Henle to the distal convoluted tubule, and then the filtrates will drain into a collecting duct that empties urine into the renal papilla, into the minor calyx, into the major calyx, into the renal pelvis, into the ureter, and eventually into the bladder to be excreted from the body. So, renal calculi. The pathology: what are renal calculi? They are solid masses that consist of tiny crystals containing calcium, calcium salts, or oxalates. When do the renal calculi pose a problem? This is whenever their minerals clump together and cling to the tissue lining of your kidney and hardens as time passes. And then you would think, who is at risk for developing renal calculi? There's people with the increased alkali in the urine, those that are diagnosed with chronic glomerulonephritis, and premature infants because of the high concentration of urine.
Okay, some types of renal calculi are calcium stones, uric stones. The uric stones are radiolucent. Struvite stones that are made of magnesium ammonium phosphate and are more common in women. 70% of renal calculi are staghorn calculi.
Okay. And some of the clinical indications for the renal calculi, or as many people know them as kidney stones. They are blood in the urine or hematuria, flank pain, some examinations that would be done to a patient to diagnose kidney stones are ultrasound, IVU, a KUB, retrograde pyelogram, abdominal CT, or an abdominal kidney MRI. And you would think, how would you know that a patient has a kidney stone? You would see the calcification upon a radiograph, and this is where like a large stone will fill the renal pelvis, and you can have multiple calcifications inside the cortex of the kidney. For your KUB or radiographs or x-rays, there would be no factors, no technique adjustments. You would, so it's 70 at 30 or 20, depending on a normal patient. We're going to show you what a kidney stone looks like inside of a patient. Here we have the right kidney of a patient and the left kidney over here. This lady came in yesterday with a history of just flank pain, and she had this huge kidney stone stuck in her right kidney.
Okay, so this is our model that we made. It consists of the inferior vena cava here, the abdominal aorta, your 2 kidneys, down into your ureters, into the urinary bladder, and the urethra. The black dots here, and in the urethra, the bladder, and the ureter, and the bladder, that is your renal calculi.
And this concludes our presentation of the urinary system and renal calculi. We hope you enjoyed it.
Thanks for watching.